Hello, welcome everybody to the February 2026 edition of AZBioPEERS. And today we have a really exciting topic as Dr. Terry Stull is here, professor of medicine at U of A, and as well as the founder of BacVax. And he will be sharing his story and just kind of giving a little bit of overview of his background and how he got to the place that he is today.
Thank everyone for being here, and I especially thank AZ Bio not only for inviting me this morning, but also the tremendous support that I've received from them and other organizations and people in Phoenix and Arizona. It's been quite an amazing journey. I'm excited to be here. I'm surprised to be here, and I take this as one journey that you might put in your background. And if you learn something from it, great. And if not, hopefully we just have a good time. So, BacVax, let's see if I've got this thing moving forward. There we go. Here's what I'm going to talk about. It's not possible. I'm a university professor. I grew up in the university. I can't actually talk without slides. They sort of keep me organized. So I thought I'd just tell you, here's what I'm going to talk about. I don't usually talk about me. However, Dylan says that that's part of the point of our discussion this morning. So I am going to tell you about me and one particular journey that reaches this acquisition phase. And so I'll spend some time on that. I'll talk about mission because mission is near and dear to my heart. And it would be impossible for me to give any presentation or discussion without talking a little bit about vaccines, not extensively, but particularly in today's arena, I think it's an important discussion. And then I'll give you bury down a little bit on what BacVax really is, and finally leave hopefully lots of time for questions. So that's the outline. So now you know where we're going. So who am I and where did I come from? And if any of you are thinking about startups, or actually it doesn't matter, just a great career in biotechnology, I'm going to describe this to you because it's remarkably unlikely. And your journey is also unique, and it will be unique in different ways. But I do want to tell anyone who's thinking of doing an acquisition and concerned in any way about their background to just forget it and get on with it. So I am born and raised in Alabama. And that's that's being kind because I was actually raised in rural Alabama, born at the Mobile Infirmary and raised outside outside the city limits of Mobile. And that's not a likely beginning for somebody who would end up the way I ended up, but so be it. Fortunately, I had great parents who did the transition from blue collar to white collar, and my father was an amazing craftsman, and my mother insisted that I be academically successful. Fortunately, at the age of 11, we moved from Mobile, Alabama, where my father was working as a civilian. He started out as a welder. That blue collar part is the welder. He started out as a welder, working for the government, working for the U.S. Air Force, and the Air Force base was being closed. And so we moved to Huntsville, Alabama. Now, Huntsville, Alabama is a unique place in the world. It was a cotton town of about 10,000. And then there was a decision made to build the Saturn rocket in Huntsville, Alabama. Go figure. And that brought Werner von Braun, the rocket scientist from Germany, World War II, brought him to Huntsville. And I actually went to school with his daughter Iris because it was such a small community, but it grew very rapidly into 150,000 people, and it was very technology oriented. And so I got a greater dose of science when I went to Alabama. Now, when I was 18, I was a bold and restless person. And so I got very, very bold and went all the way to the state of Tennessee. And it takes 35 miles to get across that line. And I went to Vanderbilt. And when I walked into Vanderbilt, I realized, I don't think I went far enough. And this was during what nowadays it seems calm, but back then was relatively turbulent times, a combination of the Vietnam War and a cultural transition from post-World War II days to the good old hippie generation. And so I was restless. And so my undergraduate degree is actually in philosophy, and I spent a year in Germany. And those times were spent doing exactly what I'm describing here, and that is figuring out who am I in the world, in this world. Now, if you ask the question, what do you do with a philosophy degree? And oh, by the way, I didn't actually take any biology in college. I mean, what was the point at that point? So, what do you do with a philosophy degree? Well, I went to my hometown in Huntsville and I taught ninth graders. And ninth graders and I were not a great match. Anyone who teaches ninth graders should immediately receive sainthood. I have great respect for people who can meander those waters. And so after a year of teaching ninth graders, I decided I should do something easy, like go to medical school. And just to tell you how sort of cerebral my approaches are, I really sat down and used my philosophy and my humanities background and tried to figure out uh, where my science background and my humanities background could be most helpful to other people. And I decided that the intersection between science and the humanities was medicine. And so I naturally applied to the University of Alabama in Birmingham, Alabama, which is really a mega and wonderful medical center. And I interviewed, and quite surprisingly, during my interview, they said that they would accept me and they wanted me to come to Alabama. And of course, I said, well, why would you do that? You never do that in an interview. And they said, with your humanities background, don't worry about you don't know a lot of science. You'll be a great doctor in rural Alabama. And I said, okay. So I went to UAB, and I might point out for those of you who are not familiar with medical education, so my upbringing was first grade through 12th grade. And after 12th grade, I did an additional 15 years of education and training before actually being an independent physician. So it's a long road. And so in this case, I started down that path, did a 4-year curriculum in 3 years. And because I graduated at the top of my class, was able to do a residency at Stanford. So in deciding what field to go into, once again, I asked the question, where did I think I could do the most good for humanity? And I had in my years going to Vanderbilt, I had earned money by managing swimming pools and coaching swim teams. And I loved working with kids. And so I decided to go into pediatrics. So I went to Stanford residency in pediatrics. And when I finished that, I did a year of chief residency back in Alabama. And during that time, actually, I should say, when I was accepted to medical school, I didn't see a lot of vacations coming down the road. So I spent 4 months bumming around French West Africa in the 70s, taking bush taxis from one place to another, and really saw how real rural, not rural, underdeveloped countries live, and the poverty and extreme illness and diseases. And so, with that experience, and at the end of medical school, I went to South Africa and Swaziland, what at that time was called Swaziland. And with those experiences, I decided to go into infectious diseases. And fortunately, matched up with an amazing mentor named Arnie Smith. And Arnie had just come from Boston Children's to Seattle. And so I spent 4 years at Seattle Children's Hospital, University of Washington Medical Center, 4 years studying pediatric infectious diseases. And that's where Arnie put me at the bench and I became a basic scientist. So after that, my lovely wife decided she wanted to go to medical school. The University of Washington didn't really think of us as residents. We ended up in Philadelphia, And I ended up at a very small medical school called the Medical College of Pennsylvania, which was originally designated and became Women's Medical College. And it was one of the five medical schools in Philadelphia. So we spent a decade in Philadelphia. And during that time, I started my NIH funding, wrote grants, did the typical basic science PhD approach, started down the path of Haemophilus influenza, which is a human only pathogen that my mentor had been working on, and was well on the way to grants. And there was enough turmoil in Philadelphia that it was time to leave. And so I became chairman of pediatrics in Oklahoma. Now, I bring you to this point and tell you about Oklahoma because Oklahoma is where I became a businessman. And the way the College of Medicine was run was each department was its own business. It made money and it spent the money it made. And I never met with the dean except the year that we went sort of in the red. And then we had to have a little meeting about what was going on. But fortunately, that was temporary. And I was able to take a poor department of a $15 million budget and turn it into a $120 million budget. So that's where business became, where I began to understand the side of business that was important. And you know, one of the hardships of leadership, there's a for the business side, there's a great book called The Founder's Dilemma. And what do you do when you found a company and it becomes time for you to move on? So one of the pearls of leadership is knowing when to leave. And it was time for me to leave, both for me time to leave, but also for the institution time for me to leave. And so when I was looking around, I had a buddy who was the physician in chief at Phoenix Children's Hospital. And I looked at Phoenix and I could see that that was something that could be very useful. So one of the dilemmas that I have, and I hope will never happen to any of you, is that I grew old. So don't grow old. It's really hard. It doesn't get better. And so there I was sitting there with my NIH grants in Oklahoma. I was chairman of the department. And I woke up one day and realized that we had been studying the fundamental basic science of how does Haemophilus influenza cause infection. And I was getting too old. And so I said, well, why don't we just get rid of it? So we developed a novel way to approach vaccines just about the time that we moved to Phoenix, where we were, as my wife says, we were chasing my daughter, who was an ENT resident at the Mayo Clinic. So part of the reason I came to Phoenix was because Phoenix is so business oriented. And I could see that all of this basic science was helping children only in the very long run. And I was running out of long run. And so to help children now, I was going to have to do something in some way with business. And it became clear to me that Phoenix and Arizona was the place to do that because it was so business oriented, such a great business environment. So I'm at Phoenix Children's Hospital, and my laboratory is at the University of Arizona. And I approached 5 years of time at PCH and decided to pull the trigger and do a startup company in order to actualize our research and begin doing true product-oriented vaccines. And so the story of BacVax is that in 2021, it became incorporated, and on July the 1st, 2021, we began operations of BacVax. And the timing was great because the Wexford building that is 2 blocks north of my old laboratory at the University of Phoenix College of Medicine, Phoenix, is 2 blocks north. It opened on July 1st, and we moved in on June 26th. So we were like right in first at the door, and it's an amazing facility, and it's another example of Phoenix and biotechnology. So it's just a remarkably unlikely pathway, and I'm so grateful for the opportunities I've had at every step to meet amazing people who've helped me be successful. And BacVax, of course, marched along, and was acquired on October 21st, or October 24th, 3, 4 months ago. So that's sort of an overview of my story. So I have very little advice for people. I'm an example, but this is true advice. It would be okay to establish your first startup before the age of 72. Feel free because because it's a high energy enterprise, and as I said, I just feel remarkably grateful that I was able to participate in it. So now let me discuss a topic that's near and dear to my heart, which is what exactly is the mission? And people go into business for all kinds of reasons. So I'm just going to be a little bit specific about me and BacVax. And maybe I can summarize, and you'll know the answer to this by telling you that from the very beginning to today and tomorrow, my entire career has been dedicated to the well-being of children. That's my bottom line. Okay, I've never been personally, I never starved. I never had worries that I was going to be in jeopardy significantly. So I don't have worries about making money. Doctors in the United States are the best paid in the world, even though pediatricians are the worst paid of the U.S. physicians. So I've never been worried about money per se. I don't personally need to be wealthy. If it happens, I'm excited about that. I'm pleased that other people want to do hardcore business. I'm totally a mission-driven guy. And what's interesting about capitalism is this interaction where you can't actually do great business long term without a great product. Okay. And you can't deliver a great product without the business piece. So, so my experience with business as a chairman of pediatrics was important for me to be successful because I learned from me, this is just personal, for me, business is a tool to arrange products for the well-being of children. That's just the way I look at it, and that's just who I am. I'm a mission-driven, in this case, product-driven person. And on the other hand, if you approach this as I want to make a ton of money, I'm okay with that because in order to make a ton of money, you have to do a great product. So there's this interaction in capitalism that I watch and observe. But because startups and business are not my natural nature, and I didn't get an MBA and I didn't spend a lot of time in business, it means that I need other people to help me. And that's what I learned as a chairman of pediatrics. So as a chairman of pediatrics, I eventually supervised 150 doctors in cardiology, GI, rheumatology, all these different medical fields, 150 doctors and 300 staff members. And I used to say that we could have this phenomenal organization if we just didn't have all these people. People are so interesting. And so what I learned during that time is how important and remarkably important leadership is. And we see this worldwide now, how the critical difference is leadership and how to take those people who are running in all kinds of directions. And supervising docs is great. So there are people who've said that supervising doctors is like herding squirrels, and I reject that concept. Supervising doctors is actually like transporting bullfrogs on a flatbed. Okay, they know exactly the right way to go. They're all independent thinkers and they're all running in different directions. And so managing that is it can be difficult, but it's phenomenally rewarding because if you can link that kind of energy and expertise to the mission, then you can have an incredible outcome. So this is my view of the mission, and this is just personal, and it doesn't represent the right way per se. So then I get this question. Is now, and this is where I have to talk about vaccines. I won't take a long time, but the question is now a good time to be in the business of vaccines? It looks like an ugly time to be in the business of vaccines. I think it's a great time to be in the business of vaccines. And so I'm going to give you why that's true. And I think it's 3 slides. So this is polio. Now, many of you may know that Franklin Delano Roosevelt had polio. And Franklin Delano Roosevelt, before the NIH had an interest in vaccines. So at that time, the NIH was in its infancy. It hadn't developed. It certainly was not interested in vaccines. And Franklin Delano Roosevelt established a foundation, a private foundation called the Infantile Paralysis Foundation. And that foundation got a group of dynamic women leaders involved. And women around the mothers around the country went door to door collecting donations. And at that time, the natural donation to ask if you go door to door was a dime. And so obviously that became the March of Dimes. And the March of Dimes paid for Jonas Salk and Albert Sabin to develop the polio vaccines. And then the March of Dimes paid for the clinical trials to determine that those vaccines would work. And now you can see in 1955, the vaccines were licensed, and you can see what happened to polio, and that is we eliminated polio from the United States. So what this is a public outburst. The public will demand vaccines. It's not and the issue about vaccines is that we've forgotten what it is that they prevent. And when those come back, like we're seeing now with measles. So this should ring a bell since we currently have measles outbreaks going on. And you can see that the vaccine was licensed in 1963. Measles could not be eliminated because it required a second immune boost. And so in 1989, a second dose was recommended. And then we are still, to this moment, officially designated as having eliminated measles. And because of the outbreaks we're having and resistance to vaccines, that likely will come back. But the long term of vaccines is very, very bright because it's so sort of, as I would say, in your face. Mothers will want their children protected. And I can tell you that as a pediatrician. Now I have the superhero of all vaccines. So the superhero of all vaccines is smallpox. Smallpox is a historical scourge. Ramses, who died in about 2000 BC, in Egypt, when they looked at his mummy, he had smallpox, may have died of smallpox. It's been a scourge, a scourge, a scourge, a scourge, and was eliminated as a natural disease from all of Earth in 1977. Now, when I prepared this slide, I was astounded. I guess I didn't realize that in the 20th century, in that first 3/4 of the 20th century, 300 million people died of smallpox. And that's almost inconceivable at that point. So vaccines are so remarkably effective, and they are so remarkably obvious to mothers and to the public that vaccines will be important. And when we forget that they're important, the natural diseases will remind us, and we will go back to vaccines. So it's a great time to be in the business of vaccine. Okay, let's talk about startups. So 90% of startups fail. Why do I know this? I know this because my son told me. So my son's on his 4th startup. This startup made it. He's with Swiftly in Seattle, and it's a unicorn. And those of you, probably everybody knows what a unicorn is. A unicorn is $1 billion valued company that's not yet gone to an IPO or acquisition. And so Ben's made it, and his first failure, his first startup failed, and he counseled his father, counseled me, and who was like, I was like dumbfounded and devastated. And Ben said, "Oh, Dad, don't worry. 90% of startups fail." It doesn't make it less stressful, I have to tell you that. But as all of you know, because you are either in business or in a startup, the response to that is that you just have to persist and adapt. Persist and adapt. And I was told ahead of time before the startup that you have to persist and adapt. And what I learned in the startup is that pivoting is the nature of a startup. So things aren't going to work. And if anybody thinks the way they started was just going to naturally flow and not be a problem, that's an unlikelihood. And so certainly in BacVax, there were lots of pivots where we were headed in one direction, and we could see that that didn't work. And I would say that even if a startup is successful, you should think about persisting and adapting, because as we know, almost all products can be improved on. And so thinking about that next generation of your product is probably worthwhile. Okay, so here's BacVax, specifically BacVax, a couple slides. What we would like to do is eliminate ear infections in young children. Why do we want to do that? It's a big deal. It's not a reportable disease by the CDC, and it's not a sexy disease because it doesn't kill a lot of children. But when you start talking to once again, you talk to mothers, you talk to families, you talk to the community, everybody can tell you a relative or a child who had recurrent ear infections and how terrible it was. There are lots of cases. They receive a lot of antibiotics. We know that antibiotics are both good for people because they eliminate the pathogen, but they have side effects like changing the microbiome and creating antibiotic resistance. It's certainly a big dollar deal. It happens because of viruses, but the viruses don't cause ear infections. They set up the nasopharynx to cause ear infections. And the amazing part about ear infections is even though we have hundreds of different species of bacteria in our nasopharynx, there are only 3 that cause 95% of ear infections. So we were working on, my career has been studying Haemophilus influenza, you see there at the bottom, and we pivoted and also studied Moraxella catarrhalis, and we were not studying the pneumococcus. Interestingly, ear infections are so remarkably common because about half of all children in the United States, more in developing countries, but about half in the United States get ear infections. And an equally big problem is chronic obstructive pulmonary disease in adults, which is the 4th largest killer internationally. And the 2 most common infections that cause exacerbations are Haemophilus influenza and Moraxella catarrhalis. So we were on the right target. So here's what we discovered, one slide. So on the left is the protein structure. On the right is the sequence of the proteins. Getting the sequence is easy now because you just send away the DNA and you get a DNA sequence, and it's easy to convert it into the protein sequence. And you can see on the right with the protein sequence, each row, each line is a different isolate from a Haemophilus isolated from a different patient. And it's looking at the sequence, and you can see that the yellow part is 100% sequence conserved. All the strains of Haemophilus have that sequence, and the blue part is not conserved. So if you were doing a vaccine, you would take the conserved part, because that way the vaccine would cover all the strains in the species. On the other hand, if you look on the left, you can see that the gray part is the membrane, is the outer membrane. And so if you developed a vaccine to inside at the bottom, inside the bacteria, or across the membrane, then the immune system probably won't get to it. So you need a vaccine on the outside. So we caught the wave. It was like surfing. We caught the wave of high throughput genome sequencing and also protein structural analysis. And our system is so wonderful because if you're going to publish this or patent this, you have to put your data in the public arena. So we can go to databases, we can figure out the sequence of all these different Haemophilus. We can take the sequence of a protein and put it into a protein portal, and out comes the potential probable structure. So, so a lot of this work was fortunately done by others, and we caught that wave. So then we took the outer portions and we mapped them to the protein sequence. And we found the regions that were conserved and on the surface. So most of them on the surface were not conserved, and most of the regions that are conserved are not on the surface. So these are uncommon regions, and we found these regions. And then we said, well, let's take these different regions from different proteins, and we put them together into a protein, a polypeptide, where these different colors come from different proteins. So this is not a natural protein, it's a synthetic protein. And it looks like it's the grand chemical reaction, but it's actually not. Since we know the protein sequence, we just take the DNA sequence that will code for the protein and we put it online into a company's database. And a couple of weeks later, for $500, they send us the DNA. On a Friday afternoon, we clone it. That's easy. And we crank out all the vaccine that we want for all of our experiments. So that's basically the technology of BacVax. And this was our first polypeptide. And if you put it in that protein portal, this is what it looks like. You can see it has some alpha helices. And some structure to it, but mostly it also is linear because it's not connected to a natural protein. So part of this was presentations. So I went to various vaccine congresses. I had the opportunity through contacts, networking, as well as these vaccine congresses, to have discussions with senior scientists at large companies. We were interested in the beginning with support from large companies in one form or another. And when I was, as I describe it, doing hardship duty at a vaccine congress in Barcelona, the CEO of GPN Vaccines was also doing a presentation. And after my presentation, he came up and he said, "Oh, we need to talk." And we instantly hit it off. This is Tim Hurst. He's a microbiologist from England who, for many years, facilitated university projects becoming businesses. And then he did it himself with GPN Vaccines. And he's an investor. He's a remarkable human being. And we hit it off. And eventually, that has led to the acquisition. So I'm going to emphasize again, as I learned as a chairman, about how it's a team sport. It always is a team sport. And I'm, as you can tell, a huge fan of figuring out how to develop teams and recognizing that every member of the team both has talents and brings to the team remarkable ability to move us forward. And usually that's in a way that I have a huge blind spot for, which is the whole point of a team. And simultaneously, some of those people have other agendas and needs. And that's the leadership issue. And it's just been a huge privilege for me to have led a team. And I might mention that that we were sitting in a laboratory in the University of Arizona College of Medicine, Phoenix, downtown, which, of course, probably all of you know the history that should have been a football stadium, but the team went to Glendale. City of Phoenix turned it into biotechnology, and here we are today. So I took the three people in my laboratory in academics, and we moved 2 blocks north into the Wexford building and became BacVax. So we were pretty well solidified as a team already, and we had our operations pretty well worked out. So the scientific team side of it worked pretty smoothly. It's a little different in business, but worked pretty smoothly. But that's not the end of the team. I mean, you need supporters. AZBio. I called Joan. I said, Joan, I'm getting ready to do a business startup. We don't know one another, but what do I need to do? And she said, oh, call Greg Garcia. I think Greg may be out there watching this. And Greg became our legal counsel. And not just a blind spot for me, but I'm just like totally blind with legal work. So I couldn't have made it without that. Certainly need investors. My investors turned out to be family and friends. And one of the reasons I was so completely driven for BacVax success is that I describe it. I started with family and friends, and I'd sort of like to finish it with family and friends. and and while my family and friends understood that what they were investing in was risky, that wouldn't help my relationships if we had failed. So investors are critical. Legal, I talked about. Finance, I am aware, understand the big picture of finance, and know nothing about accounting. And fortunately, Don Johnson educated me, brought me along, and I became the front line, but he became the organizer of our finance. Employees, I've talked a little about. We have the three of us, three plus me, and we work together in an amazing way. It's one of them, actually, probably the single most important reason that GPN had an interest in BacVax was because the team was so productive. And we did a year and a half of research collaboration, and I'm quite proud of what the team was able to accomplish, and singularly convinced, hands down, with GPN that BacVax was a worthwhile investment. Now, I came to Phoenix. Part of the agenda was because Phoenix was so business oriented, and I would say that about Arizona in general, right? It's a business oriented state, and so that has made a big difference. I mentioned AZBio, but the city. Actually, let me describe the alignment that you undoubtedly know. But the alignment is that when the city went through their strategic planning and decided to make this campus a biotechnology center, others had and also added to it. So the city of Phoenix sponsored my presence at the biotechnology conference in San Diego because the city wants the startups and businesses to do well. The county, inside the Wexford, the county runs a program and has laboratories to train people to be technicians in business. And then the state, of course, offers a wonderful tax credit for investors in biotechnology. And there are other examples, but basically, I call it a governmental alignment where all the levels of government have said, how can we contribute and support biotechnology? So that's the different levels of support. And now I'll mention the university. Universities, um, I describe them accurately that they are medieval institutions. Okay, universities were established in the Western civilization in the 1300s, and they are medieval institutions. And in some ways, they still behave as medieval institutions. And I love universities, mainly because I like complicated things. And so I was, for those 5 years, an employee of Phoenix Children's Hospital, a University of Arizona College of Medicine Phoenix professor, and moved into an ASU building. And so Wexford is a partnership between ASU and Wexford at the 850 PBC. And living in those different environments just added and enriched my life. And some people it would drive crazy, but I found it just fascinating and was able to have each institution support our effort. And each of them wanted to support our effort. And so it's been a great conversation. So I'm going to end the slides and I'm going to end on this note. If I gave you an assignment and said, write 3 or 4 pages about the airplane jet in this picture, you would describe to me the amazing, an unusual and unexpected cloud formation of wings and the tail and the front and etc. And my mother, who's now passed away, if I had taken those 3 or 4 pages and given them to her, let's see if we've got this, she would have given critique to each of them, helpful critique, and after she had analyzed them, she would have said, not that airplane, the one down here. And that's what startups are about, which is seeing things that are difficult to see and going in directions that are completely unexpected. Well, that's me, and I've tried to be as open and honest as I can, Dylan. And on the other hand, I'm certainly available for questions.
Thank you so much, Terry. That was a really, really great talk. Your story is incredible, and always excited to hear about, the future of BacVax and really where you guys are headed. And I mean, I do have a few questions that I'd like to answer just to get a little bit more depth into your story. So, like you talked about really the endurance that it takes as you're building a life science startup, and we know vaccine development is requires maybe even a bit more. So really, what were the toughest stretches for you with as you were kind of developing BacVax, and how did you make sure that you were able to like really keep going?
So number one, it was family and friends. So family and friends invested, and they supported and they helped, and in a positive way that was energy giving, and it also provided stress, which is to say, I started with family and friends. I want to end with family and friends, and so I was pretty driven for success. And like everybody in the audience, I'm a just incredibly persistent person. And it takes a lot, if I believe in what I'm doing, and I do believe in this mission, it takes a lot to defeat me. And so the other thing that kept me going was finding GPN. So I mentioned there are 3 causes of ear infections. We were working on 2. And the reason that Tim Hurst could see the partnership with BacVax is that they are working on the other bacteria, which is Streptococcus pneumoniae, called pneumococcus. And it's the bacteria that in history has caused pneumonia that most frequently kills people. And they have developed a methodology to create a universal vaccine. And on the other hand, COPD and ear infections also involve Haemophilus and Moraxella. So the partnership happened. So once again, partnerships and team sports are what kept me going.
Really, yeah, it's definitely key. And being in the 850 PBC building, I do get to, see your team working on the Connect Labs floor. And really, how were you able to, I know it's a small, scientific team, but how were you able to, build that team and then also take them from that transition from academia into, your business?
Yeah, I did want to make this point. Everybody has methods that they use to lead teams. And our method is sort of ironic that I say this. Our method is really slides. So every week we sit down and we have two topics for slides. So one topic is a big picture. What is it we're trying to do? And what are the steps that it'll take to get that done? And what is background information, because I'm always bringing sort of new scientific insights into our methodology. And then we also have a slide called priorities, and we list every member of the team and what is it that that team is working on. So I go by the philosophy that we should do the most important thing first. And so each individual, we make a list of activities that that individual needs to do. And we prioritize and put the most important one at the top and the least important at the bottom. And this will be, 5, 6, or 7 different activities. And it means that the person should work on that top one first. And on the other hand, if something's sitting around and has to incubate for a day and you're wondering what to do, then you have activity number 2. And by creating that activity list and assigning people what they need to do, everybody knows what they need to do, so everybody's comfortable. They have an assignment. They know exactly what they're working on, so it makes the messages very clear. And then the team is just sort of very bright and naturally driven to get that stuff done. And so we don't, we don't have timetables per se. We have priorities, and that priority list has been amazing and helped us be incredibly effective.
Definitely, certainly has. And we do have a question from Stacy Metzler. And she says she loves your story and PCH, so at Phoenix Children's, they're on an exciting trajectory with their new CEO. And separately, at her biotech startup, they're about 3 months into PI matchmaking to really conduct their phase 0 work that they need to generate that preclinical data. And you mentioned knowing when to jump. In your experience, is this a normal academic timeline, or is this the point where they should really fund the phase 0 independently and hire a couple of scientists to help generate data and then reassess that academic relationship at a later time point?
Yeah, that's a good point. And I notice in the audience is Guy Reed, and Guy could answer this question much easier and better and more insightful than I could. It's a little bit of a balance. So the nice thing about being in academics, if you're successful in academics, is that it can give you a foundation for your company. And as long as that foundation works, then it's a more solid foundation in many ways than investors. And so jumping out into the investment approach is much as long as you've got support in academics, and that may involve getting NIH grants or whatever the source is. But as long as you've got that support, then jumping out in a startup is by its nature high risk. So I think it's a balance because you want to get to the product. But the way I would describe it is it's sort of like universities and medieval institutions, which is that it's complicated. And what you want to do is to take advantage of the strengths of both sides. And the two sides want you to do that because they want you to be successful.
And I see, Guy, you have your hand up if you'd like to, give any insight that you have.
Well, I don't know that I have any insights, but I do want to congratulate Terry on such an inspiring story and trajectory. I got to watch a little bit of it and the arc, and it's great to hear about that. Terry, I would say to you, or the question I would ask you, for here at the College of Medicine, we're trying to encourage our scientists to branch out and to develop their research beyond just mechanisms and to potential patient impact. What would you say to your younger self about this journey? Would you have started at an earlier time? Would you have done it a different way? I'm just curious on your reflection on this.
Yeah, everyone can tell that Guy is also a clinician and and understands, and of course has his own business, scientific business direction, and understands, like I do, that having these things is not useful unless they actually reach patients. And so for me personally, my mission in Oklahoma engaged me so thoroughly. So I didn't mention I was grateful to partner with a community organization and raise $100 million for 37 $2 million endowed chairs in Oklahoma.
Wow.
And that guy will understand that fundamentally changed children's healthcare in Oklahoma. And we recruited the medical director of the largest diabetes center in North America out of Texas Children's to Oklahoma, recruited John Mulvihill, who was a long-term Hopkins geneticist. So we were able to bring in national stature people. And so that consumed my activities, was to rebuild a broken department and bring it to a level of national stature. So on the other hand, if I'd taken the other path and said, why not do a vaccine earlier, then that would have just been another vaccine. I mean, another approach to life. And I think you make a great point, Guy, which is to say we all have these branches in life. And another point is that our technology could not have been done before high throughput sequencing. And so all of us are sitting with these talents, and we're looking at life's opportunities, and we're matching our talents with life's opportunities. And in my case, and in your case, obviously, because you're here today, you're asking the question, how can we make the greatest impact? And so I think when I talk through this answer, Guy, we could not have done this without high throughput sequencing. And
Yeah.
so our pathway, then the timetable was determined. Now, on the other hand, could we have done something different? Well, because I was a chairman, I didn't really have time to switch scientific fields. That's kind of a big enterprise. So I was kind of stuck in Amophilus. So within the framework of a short number of years, I think we maximized what we could do. But my answer is totally circumstantial.
Yeah.
Without through high throughput sequencing, we couldn't have done it.
Makes
Thank
sense.
you. Thanks for the question, Guy. And Guy knows our journey because he was my dean.
Really amazing. And as we kind of wind down, there are a few questions that I don't think we'll be able to get to. One, just kind of asking you to look into your crystal ball. What would your crystal ball tell you about when you might have a vaccine to start testing patients?
This is great. So traditionally, if you finish all of our preclinical work and you fire the gun at that point, it takes 10 years and about $500 million. So vaccine are slow go, and they're difficult. And on the other hand, once they're in place, they tend to make a ton of money and be a great payoff. And so the answer is that we have a good prospect for Moraxella. We've still got to work, but we think we have a pathway for Haemophilus. And so I think that in a couple of years, we'll have it. And 10 years after that, we're going to eliminate ear infections.
There you go. And for closing words, Terry, for scientists considering that entrepreneurial leap, especially those in infectious disease, what should they know before they start?
So what you should know is that it's impossible for you to know what you should know. What you should know is that once you do it, there will be things come at you that you can't predict. It's just this onslaught of activities, companies out there doing things, collaborations, internal issues. And so I think you just have to be try to be centered and try to be responsive and know that you're just going to have to continuously pivot. That's the nature, I think, of independent startups, where everybody's salary is dependent on the startup, and just staying focused and getting one good thing done after another, and then simultaneously being pulled in all these other directions and willing to change directions. I think that's the nature of the beast.
I think that's huge. Yeah, the focus, making sure you're, accomplishing some goals as you're being pulled in every other direction. I think that really is key. And of course, as you said, having that team, having those supporters that make sure that you're able to answer any questions that you can answer yourself. So, well, thank you very much, Terry. This was a fantastic talk. Thank you, everyone, for being in attendance. And of course, feel free to reach out to us at AZ Bio, reach out to Terry. We could definitely put you in touch with Terry.
Yeah.
And that's why we're here. We're here for the community of life science here in Arizona.
Dylan and everybody in the audience, thank you very much.
Thank you, everyone. Take care.